I see patients coming to my office because of poor lymphatic obstruction from something like filler, I do a few things. So this is kind of like my protocol where it's like improperly placed, too much is placed there, because all you need is like a quarter to half a syringe, or when it's improperly placed really deep, or the wrong product is used. So we were talking about different types of filler on your show where you have thicker filler and you have really soft filler that's flexible. I personally use a product that's so soft and watery that's flexible under the eye. I personally think a lot of the issues come when someone's using like something like Voluma or something, Restylane Alice, something so strong under the eye where it's maybe for them that wasn't the filler that was supposed to be used under there. Basically, I go in and I dissolve it. If it's needed, people shouldn't be scared of it. Expect a trade-off of wrinkles in that area, because if it's really puffed up, and I'd rather someone have wrinkles and it look natural and it have the concavity there and the tear trough there where it's supposed to, where it's not super flat. I would rather people have wrinkles than like a super puffed out under eye bag from filler. I go in, dissolve it, and then I go in with radio frequency microneedling. I don't know if you guys know this, but some research has come out, and radio frequency in general increases those lymphatic vessels. So it actually has been shown to help with that drainage in that area. So either with like a radio frequency wand, I'll have them use that, or I have patients go in 3 sessions of radio frequency microneedling with something like Morpheus to help strengthen that skin there so it can hold potentially new filler, and so it can help with that lymphatic drainage. And then number 3, we want to heal the skin from the inside out. So then I'll do something like PRF, which the difference between PRF and PRP, they're not actually stem cells. Stem cells are like literally if an orthopedic surgeon's like going into your bone marrow and pulling that out and putting it into your hip. These are like pulling in stem cells. So PRP, we pull your blood, draw it, we pull your blood, spin it, and that basically pulls in those stem cells because it has growth factors and it pulls it in for like hours to days, versus the PRF, which is pulled the same way, almost made the same way. It has that like scaffold of a matrix on there. So it pulls in those growth factors for like weeks to months instead of like hours to days. So that's why it's more regenerative. So I love that people are doing that under their eye to help like heal the skin. And then after that, after it's been like a couple months, I may go back and like refill the area, or I'll send that if I feel like they need like a bleph or something, which is like repositioning the fat pad, moving it around or completely removing it. I'll have them do that. So that is like my whole little protocol with that.